Okay, welcome to the 2024 Equine Health Series. This is our fourth and final webinar of this series. These webinars are delivered with Michigan State University's College of Veterinary Medicine and My Horse University, an online horse management program based in Michigan State University Extension. You can use the Q&A tab to type in questions and press send during the presentation. If you are joining us from Facebook, please type your questions in the comment section. If a question isn't answered right away, our presenters will field those questions at the end of the presentation. So my name is Julie Strakota. I am an assistant professor at Michigan State University's Large Animal Clinical Sciences and collaborate with Christine Skelly at My Horse University to deliver this webinar series. Tonight, we are very excited to welcome Dr. Jamie Pribyl, who will present Getting the Best Veterinary Care When Equine Veterinarians Are in Short Supply. Dr. Pribyl received her DVM degree from the University of Minnesota in 2004. After completing an equine internship at Palchuk Veterinary Hospital in Washington, Dr. Pribyl joined Buffalo Equine in Buffalo, Minnesota. She practiced for 14 years and was a managing partner for 12 years. In January of 2020, she joined Boehringer Ingelheim Animal Health as a professional services vet. Dr. Pribyl's professional interests include asthma, endocrine disease, reproduction, and gastrointestinal disease. She is passionate about professional wellness and leadership and is a past member of the American Association of Equine Practitioners Wellness Committee. Dr. Pribyl serves as the AEP Ethics Committee and the Practice Culture Subcommittee. Outside of work, Dr. Pribyl and her family raise racing quarter horses and barrel horses. They also enjoy weekend competitions, trail riding, and horse camping. Welcome, Dr. Pribyl.
Thanks, Dr. Strakota. Thank you so much, everyone, for joining us tonight. I am excited to talk to you a little bit about the state of the equine veterinary profession and the effects that might have on you as horse owners, and what you can do to help ensure that your horses and yourselves get the best care in this time. So we'll get started, and of course, happy to take any questions, and most of those will be probably answered towards the end, just so that we can get through all of the material and make sure that everybody has a chance to hear what I have to say tonight. So we're going to start with talking a little bit about the state of the equine veterinary profession, and then we'll get into what you guys can do as horse owners to ensure that your horses are going to get the best care. We'll talk about the VCPR. Don't worry, you don't have to know what that is right at the moment. We'll talk about getting the most from your appointment, emergency planning, and then how, what are some of the ways that you can get educated as a horse owner, and you're doing that tonight. So good job to all of you who have joined tonight and who have joined other webinars like this one. So when we talk about the state of equine practice, we're going to talk about it as it is today. Where are we now? And sort of where are we heading? So a lot of the numbers and statistics I'll share with you tonight are from a document called the AVMA AEP Economic State of Equine Practice Report, and it was published early in the year, so early in 2024. And so the data is very, very new, coming all from the end of 2023. So if you've been reading any headlines in, any of your equine publications or online, I'm sure you've seen some of these headlines, the dwindling supply of equine veterinarians, talking about the shortage of equine veterinarians rurally, but actually we're seeing it, pretty much everywhere throughout the country, and that we're actually in a little bit of a crisis. And that's true. But there's a lot that's being done about it. So I'll share that with you as well. So I wonder if anyone here, if I actually had the opportunity to do a poll with you if you would have any idea how many equine veterinarians there are in the US. And when I'm talking about equine veterinarians, I'm not just talking about equine exclusive, but rather, equine exclusive veterinarians, but also veterinarians that focus on equine practice that may practice in mixed practices as well. Well, you might be shocked to know that there's only about 3,800 or so of us for the entire United States. And if you think about that, that's not a very big number. And if you look back at, there's not really a true consensus on how many horses there are in the US, but the best guess that we have comes from the American Horse Council. It was a 2017 economic impact report that they put out, and their guesstimate at that time was about 7.2 million horses. Now, obviously, not every single horse, unfortunately, not every single horse in the United States sees a veterinarian, but I would like to think that the majority of them do. So when you think about that number, it's really quite low. So we have a couple of issues in the equine veterinary profession that we're dealing with. And one is recruitment and the other one's retention, which I'll get into in a minute. So when it comes to recruitment, really all we're seeing right now is, the numbers are really low as far as veterinary student graduates that are actually entering equine practice. So last year in 2023, we saw 6.1% of veterinary graduates entering an equine focused type of practice in 2023. The good thing is that number is actually up a little bit from 2022, where we only saw about 5.7%. Now, of that number, so what does that look like actually when it comes to numbers? So 170 graduates entered equine practice last year. But the job postings that we have right now for equine practice throughout the country, 346. And of those 170 that actually went into equine practice last year, the great majority of them chose to do an internship. An internship's like an extension of our education. And a lot of graduates that enter equine practice choose to do an internship because they don't necessarily feel 100% prepared to go straight into practice. And they'd like another year with extensive training, which is what an internship is, allows you to gain a lot of experience in a very, very short period of time while being mentored by some excellent practicing veterinarians. So of those 170, 133 chose to do an internship, which is great. And about 37 went into an actual associate position, hopefully with great mentorship. So why do we have such a low number of graduates that want to go into equine practice? Well, there's multiple reasons. Of course, everything always comes down to being a multifactorial problem, but equine veterinarians have like most veterinarians, they have a large debt to income ratio, but that ratio is actually larger for equine practitioners than it is for our companion animal counterparts or those entering other careers in veterinary medicine. So if you look at debt for those entering equine practice in 2023, the average debt for an equine practitioner was $154,000. But 1 in 3 of those 170 graduates that entered equine practice had debt over 200,000, between 220 and 300,000. And then if we look at starting salaries for equine veterinarians, they're actually quite a bit lower than any of our other counterparts in veterinary medicine. They're actually the lowest, along with mixed animal practice. So why do you want to become an equine veterinarian? Why did I want to become an equine veterinarian? Because that's what I wanted to do. That's all I've ever wanted to do. And I had a passion for it. And so most of us realize that this is an issue when we're going into equine practice, that, salaries aren't as high as in other parts of practice, but it's because we have a passion for it that we go into it. However, it's still difficult. And as you go through school and get closer to graduation, you realize that, wow, I do have a lot of debt hanging over my head. And so you might be discouraged by others as you go through school that suggest maybe you take a small animal job because you'll make more money and hopefully be able to ride your own horses. Oops, just lost my earphones here. And maybe have more time. And the other thing that we're seeing is that there's a lot of corporations that own companion animal practices now, and they tend to offer some nice signing bonuses to students in their fourth year to entice them to take jobs in the small animal or companion animal side of things, which we don't see a lot of that coming from the equine side, because most equine practices are still owned by equine practitioners themselves. So they don't have the corporations standing behind them with lots of money and the ability to offer large signing bonuses, or even entice students to sign with them because they'll offer a repayment plan for their student debt. And then we also have a lack of equine interested students entering vet school as well. So the great majority of students that enter veterinary school are more passionate about small animal practice. So that's on the recruitment side. So what about retention? So again, I said there's about 3,800 equine veterinarians practicing in the US. Of the new graduates that we see enter into equine practice, greater than 50% tend to leave equine practice within the first 5 years. And where do they go? They go either to companion animal practice, or they leave the profession altogether. And then 48% of AAP members, which is the American Association of Equine Practitioners, which is the largest organization of equine practitioners in the world, 48% of them are greater than 50 years old. So we have a lot of folks in our profession that are sort of at the tail end and hoping to retire at some point. And 27% are greater than 60 years old. So hopefully they're going to get to retire as well. So besides retirement, why do they leave? Mostly for these things. So the top things are listed there in that graph. A lot of the exit interviews for veterinarians that leave equine practice, the top 4 things are really to do with well-being, lifestyle, work-life balance, emergency coverage. So if you think about it, 64% of equine veterinarians are actually in solo practice. So they're in practice by themselves, which means that they are basically on the job 365 days a year, 24/7. And then client expectations, maybe veterinarians not having, good boundaries, which I certainly didn't have in practice, where you may give out your cell phone number and answer the phone all the time, maybe even if you're not on call. And the long hours. So most equine veterinarians in a recent survey said that they're working upwards of 56 hours a week. So that's on average. So there's certainly times when they work more hours than that as well. And then compensation, we already touched on that a little bit. We talked about low starting salaries, but in equine practice, we also tend to see only small bumps in compensation with experience. So the salaries don't go up as quickly as they do in other parts of the veterinary industry. So the AAP, or the American Association of Equine Practitioners, sees this as the number one issue facing equine practice. And they identified, again, recruitment and retention of young graduates as the most important issue back in 2021. This isn't a new problem, but it's finally reached the crisis state. So in 2022, they established a Commission on Sustainability in Equine Practice, and they hosted a practitioners summit, basically gathered a bunch of those 3,800 veterinarians together to put their heads together to come up with, what are the pain points in practice? Why are we losing people? How do we get people to stay in practice? And from that summit, they developed 5 subcommittees. And these focus on the major pain points that we're seeing for veterinarians. And each of these committees consists of a diverse group of equine practitioners that have volunteered to do the work needed to develop solutions. And I want to highlight that the committee members that do this work, they volunteer to do this work. There's approximately 15 members on each committee, equine practitioners from all different types of practices all over the country that are passionate about equine practice and getting practitioners into equine practice and keeping them in equine practice. So I won't go into all the details, but we're looking at compensation. We have a student subcommittee, internship subcommittee, emergency coverage subcommittee, and practice culture subcommittee. And obviously, these all overlap in different ways, right? Certainly, internships are going to overlap with practice culture. Being properly compensated is going to have something to do with emergency coverage and compensation for emergencies and things like that. So all these committees are actually working together as well. And we've seen a ton of action items developed and deliverables developed by these committees over the past couple of years, and we'll continue to see that. And we're already starting to see some changes in attitudes and excitement about practice. And even on the student side, when I talk to students and we talk about what's going on, they're more excited about looking at equine practice as an option for their future. So a lot of great work being done. And then other people and corporations and organizations are doing things as well. So just to highlight that Boehringer Ingelheim, who I work for at this point, we've created an initiative called the Stable Life, which is dedicated to helping equine veterinarians thrive. So it's an initiative to help transform the future of equine practice to thrive, and most importantly, to help inspire well-being, to help veterinarians live and work their best. Because we know if people have good well-being, they're going to be able to provide the best care to the horses that we love. So why am I telling you all this? It sounds really sad and doom and gloom, and I don't want you to feel that way, but I do think it's knowledge is power, right? So we need horse owners to know what's going on, so that you understand where your veterinarian is coming from. And there are things, believe it or not, that you can do to help in this situation as well, but also to ensure that you can get the best care. Because if we don't have enough veterinarians to do the job, there might be the possibility that you might not be able to get a veterinarian when you need one. So hopefully we'll get some information tonight that I'll share with you that can ensure that you have access to care when you need it. So currently we don't have enough veterinarians. Your veterinarian is doing the work of multiple veterinarians, I assure you of that. Emergency coverage, we'll talk about that a little bit later, but there's a possibility that there might not be someone there to cover your emergency when you need it. So planning and knowledge, again, is the key to ensuring that you're going to get the best care. So we're going to look at horse owner best practices for best care. So there's a number of things that we need to think about. The goal that we all have as a horse owner and as a veterinarian is the health of your horse, right? So we're going to talk about the veterinary client-patient relationship, or the VCPR. So that's what those letters stood for earlier. We'll talk about appointment day best practices, emergency preparedness, how can you prepare for emergency, and then education, which again, you guys are doing tonight. So what is the VCPR? It's the veterinary client-patient relationship. So a good long-term relationship between owners, trainers, veterinarians, and patients is essential for providing the best care for your horse. If possible, it is great to have a relationship with one veterinarian. It allows them to get to know you and your horse very well throughout the years. These are always my favorite kind of clients and horses in practice, because I looked forward to seeing them and their horses, learning about their plans and successes with their horses and their goals, talking about their families, watching their kids grow, and watching horses go from maybe one kid to the next. But in other situations, you may have a few different veterinarians that specialize in certain parts of veterinary medicine. For example, you may have a veterinarian that specializes in dentistry and another that sees only lameness cases. If you choose to see multiple veterinarians for different areas of care, it's still imperative for you to establish long-term working relationship with each of them so that they can get to know you your goals for your horse and your horse itself in the best way possible. And then finally, always be sure to establish a relationship with your veterinarian prior to an emergency. If not established ahead of time, you might find it difficult to find someone who is available. And veterinarians, we'll talk a little bit more in later in the presentation, but more and more veterinarians are moving towards only seeing emergencies for established clients. So there's some different, most of you are going to recognize the type of appointments on the top here. So the farm call, for years and years, veterinarians have been traveling to the farm, and it's still the majority of the way that we see horses, but we also have haul-in appointments as well for some veterinarians that have haul-in facilities. But you may or may not have heard of telehealth appointments for equine practice, but you probably have heard of telehealth appointments with your own physician. So what does that have to do with equine practice? Well, during COVID, telehealth appointments did become somewhat common. But since restrictions have eased from COVID, we've gone back to mostly face-to-face appointments. But it turns out that there's some significant advantages to telehealth. Now, I'm not saying that we are going to get away from farm calls or haul-in appointments. Those are going to remain the majority of the types of calls that veterinarians do. But there are appointments that can be seen, or can be at least things that can be discussed through telehealth. And this can be advantageous, especially in times of veterinary and staff shortage. We're also seeing a shortage of staff as well, and being able to keep and retain staff in equine practice. So many vets are actually implementing telehealth into their practice. So I don't want you to be surprised if this is offered as an option to you. So what might that look like? Well, it'll depend on the situation. But an example would be, for example, if your horse had PPID or Cushing's, for example, and maybe you're considering making some feed changes and you have some questions on diet, a telehealth appointment or a consultation may be appropriate in that situation versus, an on-farm or haul-in appointment. And then this would be a billable appointment. Also, what's a technician appointment? So again, maybe some of you are seeing this already, but depending on where you live, veterinarians may be sending technicians out to do some appointments that they are perfectly capable and credentialed to do. So credentialed veterinary technicians are essentially veterinary nurses, and they have the knowledge and skills to do many things. Now, this is going to vary depending on what state you live in, because each state varies on the procedures and things that technicians can do in the absence of a veterinarian. So depending on what state you are in, your veterinarian may be able to schedule technician appointments for things such as blood draws. Maybe it's a repeat follow-up blood draw, Adequan or Legend injection, vaccines, and a big one that's really, really handy is for those bandage changes for wound care, follow-up wound care. And technicians are perfectly capable of doing these things. So you may be offered that type of appointment in these type of times. It also gives our veterinary technicians the opportunity to use the skills that they have and give them some anonymity, and it's more enjoyable. Their job is more enjoyable, more exciting to them when they can do the things that they're perfectly capable of doing. And then, of course, there's the emergency appointment. That's not an appointment you can plan for, but we'll get more to the emergencies in a minute. So farm calls and haul-in appointments and best practices. And why do I want to talk about this? A lot of this stuff is going to seem like totally common sense to you. But believe me, over the years of practice, I've seen all sorts of things. And I've developed a list of things that I would like clients to know that would make that appointment go quicker, more efficient, be easier for everybody involved, and allow me as the veterinarian to spend the appropriate amount of time talking with you, the horse owner, about your horse, examining the horse, and providing that horse with the best care. So I'm going to go through some tips. Again, some of them are going to seem like very common sense, but sometimes we just need little reminders of what are things that can make the day go smoother. So for farm calls and haul-in appointments, it's really important to make a plan. What's the appointment for? So what are your objectives? What are the objectives for your horse and for yourself? You're going to want to make a list of what your horse needs. What are you looking for? Is it an annual exam and vaccinations? Do you need a dental? Is there a lameness? Do you have weight concerns? Make a list of all the concerns you have, such as, I need recommendations for feeding my hard keeper, or I need my horse to be ready for a big show in a month. And then you're going to want to, of course, take a look at your calendar, come up with some days and times that are going to work best in your schedule, and try to pick days and times when you know that you're not going to be rushed, that you're not going to be needing to, rush off to work or pick up the kids from school. And then keep in mind, again, in this time of veterinary shortage, you may need to book several weeks out. In practice, I ran into a situation a lot where people, were used to getting appointments the same week. And then all of a sudden, we're in a situation where we have too much work, too many appointments, and we can't get people in for 2 to 3 to 4 weeks. So especially in the busier seasons, but it really seems like veterinarians are just busy all the time right now. It doesn't seem like one season is necessarily more busy than the other, except for maybe spring, but that busyness seems to carry through even in the slower months, which typically in the northern part of the US are going to be, through the winter months, but even those months seem to stay busy now. And then make sure you ask about cancellation policies, because when you cancel last minute, that really affects everybody and it affects the whole day. And some veterinarians may now be actually charging for cancellations, similar to when, if you cancel last minute on your dentist or for your chiropractor or something like that, you may see a charge for something like that. Not everybody, but it's just good to know and be prepared. All right. So schedule. Now, how you make your appointment is going to depend on the practice and the preferred method of communication. When I left practice 4 years ago, our office still preferred a phone call. So a discussion over the phone obviously allows that staff member to gather all of that information about your horse, ask you questions, search those vet records, and give you different options of dates and times all in one step. Not all clinics may accept appointments by email, text, or online, but it's becoming more common, of course. So scheduling through these platforms, just be aware it may require some more back and forth, right, than your typical phone call will. Whereas a single phone call could maybe accomplish everything, in one step. So, again, lots of details here. Let the office know all of the details, the number of horses, the purpose of your appointment. Ask them to check the records for things due so that you don't forget anything. It's always good to, be clear about all the things that you want accomplished in all of your concerns. And what this helps with, is just the timing and how much time we actually need on the farm with you and ensuring that you are going to get the amount of time that you and your horse need. So for example, if you want the veterinarian to check your horse's teeth, if the horse needs its teeth done that day, are you going to want that dental done that day, or are you going to want to schedule it a different day? That's really important for both you and the veterinarian because your time is valuable as well. And then letting the office staff know all of your concerns and expectations up front allows them, again, to schedule enough time for you and for the doctor to spend with you and ensure the right veterinarian is going to be there and that they have the right equipment with them as well, right? Because we can't fit every piece of equipment into that one truck, although we would love to have every piece of equipment with us all the time. And then, there's always that classic, on the farm would happen to me a lot and to most of my colleagues, while you're here, doc, can you check my other horse's front foot? Or I noticed this or that. Can you check this? And we don't ever want to say no because we like doing what we do and we want to help you. We want to help your horse. But um, it runs the risk of the doctor having to say no due to time constraints and you having to schedule another visit, which you won't like because you'll have another farm call or another haul in. But most vets will make that effort to squeeze that last minute request in, but it really puts a wrench in the day because, of course, we have other appointments waiting for us, other horses and clients waiting that have set their time aside for their appointment, and it makes us late for the rest of the day. And of course, it makes us run late for the end of our day too, right? Because we all have families and we all have other things that we want to do at the end of our day. So an example would be, I need the doctor to come out to do spring vaccines. In addition, my horse has been coughing a little bit when riding, so I want to discuss this too. So add on all those little things, even if you don't think they're really important, they just tell the receptionist about all of them. And then where will the appointment be? Always make sure you tell them, is it going to be at home or boarding facility? Make sure they have the correct address because often horses get moved from one facility to another. They go out for training and maybe it hasn't been, a year. It's been a year or 6 months since the veterinarian saw your horse and they don't realize that they've moved. I've certainly gone to the wrong farm multiple times over the years. All right, so what do you need? It's a great idea to write down all of your questions and concerns ahead of time so you don't forget. I do this with my kids when I go to the doctor with them. I have everything written out so I don't, get in there and I'm not like the deer in the headlights with, I know I had 6 more questions, but I don't remember what they were. So I try to write them all down. Otherwise, I get home and I realize I forgot to ask about something. So have your horse's vet records on hand. If you've seen another vet, especially, definitely don't hide that. I find that sometimes clients don't want to tell me if they've seen another vet in the meantime. We all need to work together. And if you've seen another veterinarian, I need to know about it. We all need that information. It's going to help us look after your horse better. Your regular veterinarian, if you're seeing your regular veterinarian, they're going to have your records in the office. But if it's your first visit with this veterinarian, it's very helpful to have all those historical records. You may have them faxed over or emailed over to the clinic in advance. But if not, have a paper copy with you. And then also remember, if it's an after hours call, that your veterinarian may not have access to those records directly, although most of the time now we do have access to records in a cloud. But just in case, it never hurts to tell them some of the history of the horse to remind them. And then if your horse has had any reactions to medications in the past, make sure you tell your veterinarian that even if it's a vet you've worked with for years and years and years, remember, we see lots of different horses. We should have that information. We should know that information coming to your appointment, but it's always good to be proactive and remind us just in case. So your list of questions, your previous vet records, yes, and a method of payment. So ahead of time, know the clinic's payment policy so you're not surprised. So there are some practices still offering billing terms, but most are moving towards payment at the time of service. And many clinics will also securely store your payment information for you, such as credit cards to be charged following the appointment, which can be a really nice convenience if you happen to be, out of town during an emergency, or if you can't be there during an appointment. So who will be there? So in practice, I always preferred having the owner there. It's almost always the best because we can converse, we can have a good conversation. Don't get me wrong, I also enjoy working with trainers and farm managers, but it's always more personal when the owner is present at the visit. Remember that you as the owner are a wealth of knowledge about your horse, and working with your vet too for yourself will also help you expand your knowledge of horse care. Plus, it saves your veterinarian from having to call the owner after they've already talked to the trainer or after they've talked to the barn owner about all the aftercare and everything like that. So if you can't or won't be there, for sure make yourself available by phone. And always, obviously, you want to make sure that somebody else is going to be there. That might be, your friend or your family person, a person from your family or something like that. You see the horse in the middle there with that upside down halter on that. I'm sure, there's a couple of vets on the call here that have probably seen that when the horse dad has been voluntold that, he has to go out and hold the horse for the vet. Most of the time that works out just fine because most of those kids' horses are easy to handle and you don't need a lot of help. But it's always good to make sure that somebody that's very capable of restraining that horse to keep the vet safe is going to be there for that. And then make sure that, I'm sure all of you on the call would never go into the barn in flip-flops, but if you're not there and you're sending somebody out or you're sending your teenagers out to hold on to the horse for the vet, make sure that they wear appropriate clothing and appropriate footwear, because I've sent many a person back to the house for having the wrong footwear on. Because of course, when we're there working on these horses, the horse doesn't always love that we're working on them, right? We do things that make them uncomfortable, and they may jump around, and they may jump on me, or they may jump on you. And we certainly don't want to treat any human beings. That's not what we're here for. Otherwise, we would have gone into human medicine. All right, make sure that your space is, again, clean and uncluttered. You want to have a nice, clean, open work area, which is going to make it safe for you, safe for the vet, and safe for the horse. If your horse happens to react quickly, you don't want them jumping into something that could hurt them or pin you or the veterinarian between something. So your work area doesn't have to be fancy by any means. If you don't have a barn, we might need to work outside or inside a 3-sided shelter. That's just fine. If you're working outside in a paddock, stay a safe distance from the fences. This way, if your horse jumps, they won't become tangled in the fence or accidentally get zapped by an electric wire. That's always more excitement than we want for the day, of course. So also think about what your vet might need when they get there. Will the vet be doing anything requiring power, such as, x-rays, ultrasounds, clipping wounds, things like that? Be sure that there's access to an electrical outlet, a working electrical outlet in the barn. If you happen to not have electricity in the barn, that's okay. Just be sure that you have a long extension cord that you can run from the house or from a nearby shed to the work area. Also remember that many procedures are going to require warm water. So sheath cleaning, breeding work, wound care, if you're lucky enough to have warm water in your barn, that's awesome. But if not, bring some down to the house from the house in a clean bucket. And in those winter months, a tip would be to bring the hottest water that you can, because of course it's going to cool off. It'll cool down and we can always add cold water to that super hot water. And then quiet, good lighting. These things are huge, right? Most barns don't have the best lighting in them. So try to find a space that has really good lighting. We might need to work outside if it's a nice day. Sunshine is often the best light that we can get, but it's not always possible. We don't always have the best situation, right? So try to find that well-lit area. And then other times we need a dark area. If your horse needs an eye exam, a nice dark area is required to do a good eye exam. And then quiet. Why quiet? Well, if your vet needs to do any auscultation or listening to the heart, listening to the lungs, things like that, we need it to be very, very quiet, especially for listening to the lungs. So turn off fans and radios and try to find a quiet area. Wind can be a really big problem. I know today, I don't know where you all are, but where I am today, the wind is blowing about 40 miles an hour. So when that's whistling through our ears and we have our stethoscope in to try to listen, we can't hear anything. So we need to just find a place to get out of the wind, even if it's a 3-sided shelter. And then if your lameness is due, or if your vet is going to do a lameness exam, footing is huge. Good footing is essential for a lameness exam. Don't need a fancy arena or anything, but a firm driveway like this one would work really well. For a thorough lameness exam, we're probably going to need to, lunge your horse or even ride it. So good footing for this and an area for this is important. If we're dealing with, wet grass or deep mud or icy driveways, in Minnesota, there's lots of icy driveways. That will make a thorough lameness exam impossible. So if you don't happen to have a good area or the weather's not cooperating for that, you should consider either hauling into the clinic if that's a possibility, or see if you can haul to, a local indoor for your vet visit. Or again, if it's just a timing thing with weather, you just might want to reschedule for just a better day. So preparing your horse, this is a cartoon that's been around for years, and I just love it. It makes me laugh every time. I'm sure some of you on the call have a horse that is exactly like this. So have your horse ready when the vet is going to be there. Most of the time, veterinarians or the office we're going to give you a call and a heads up that we're on the way. So don't wait until your vet arrives to catch the horse. Inevitably, the most easy horse to catch will become uncatchable once the veterinarian arrives. I have seen this with my own horses who are perfectly catchable when the farrier shows up, and my perfectly catchable horse is now not catchable at all. So having them caught and ready is huge. Again, it's going to, we have that certain window of time that we have to work with you, and we want to be able to use that for you and your horse. And if we have to spend 20 minutes waiting for the horse to get caught, that's going to reduce the time that we have with you and make us late for our next appointment too. So well-fitted halter and lead rope is essential. So if the halter is too big, like some of the rope halters, which I know are really nice and really easy to put on, when they're too big, it makes it, and we have to do any kind of restraint with the horse, it makes it difficult to restrain them. And if they're too small or too tight, it can make us, it can irritate the horse, prevent us from opening the mouth. So if it's too small around the nose, we want to do a dental exam. It's really, we can't get the horse's mouth open because it's too small around the nose. I know these are super small things, but they make the biggest difference in the world. And then getting your horse clean. And I know this is super hard. It's springtime right now, and it's mud season, right? And when do we do all the Coggins forms? We do them in the spring, the worst time of year, when the horses look the worst, and when they're muddy and dirty. It can be really hard. I appreciate that. I have 8 horses myself, so I get it. But a clean horse is going to facilitate a good exam for your veterinarian. It's hard to see through mud. And also for Coggins photos, we have to have them clean because all the markings need to be easily seen. And then manners. This is so important. Good horse manners make it safer for you, make it safer for the veterinarian, and safer for your horse. So make sure that you work with your horse consistently on their ground manners throughout the year, so it'll be natural on the day of appointment. That being said, if you know that your horse can be difficult in any way, make sure you let the vet know before they approach your horse. That way they can be extra careful and more vigilant to keep themselves safe. Many times over the course of my career, I've been working around a horse, been taking a temperature, and had an owner say to me after I'd done it, "Oh, I can't believe you got my horse's temperature taken. He usually kicks when I try to do that." Thank you very much for not letting me know. At least if I know, I can prepare myself to jump out of the way quickly if I need to, or maybe make a decision to do something in a different way, maybe use some sedation or something like that. Again, if your vet gets hurt, they're not going to be able to work for a while. They're not going to be able to be there for you and for other people. So we want to keep our veterinarians safe, and we want to keep you safe. And we know that when horses get nervous around us, they can jump around, they can jump on an owner too. So we want to make sure that our owners, our trainers are safe as well. So handling your horse for the vet, pay close attention to their demeanor at all times. It's really easy to get distracted. And I find myself being distracted too when I'm holding the horse for the farrier, for example. I'm thinking about other things. I know my horse is good and they're going to stand good. The truth of the matter is I don't really know that. Even if they're the best horse in the world, they can always do something silly. They're a horse. They can always do something stupid. And so I have to talk myself and remind myself to continue to be vigilant when my farrier is working on the horse. Same thing for when the vet's working on the horse with you. So, um, you know, put the cell phones away. It's especially something I talk to young kids about because they've been born with a cell phone in their hand and they just want to be looking at it all the time. It's so important to pay attention to your horse and their demeanor. Don't assume that your horse will behave. Even the most well-mannered horse can react negatively during a veterinary exam. So remember that the veterinary visit isn't always comfortable for the horse. We cause pain by giving injections. We cause discomfort when we pass stomach tubes or do rectal exams. We get into trouble when we assume and we aren't vigilant. So here's my story. Don't assume. Here is Crystal Get Your Pistol. She in this picture, she is a 25-year-old pony, and my daughter is about 4 there. She's been riding her by herself since she was 3. You can do anything with this pony. She is the safest thing on the planet, right? So I decided, I didn't decide. I had done an exam, and Crystal needed her pastern injected. And because Crystal is so great and so easy to work on, I decided that I would just take on that role and do it by myself in the cross ties. So I sedated her, I scrubbed everything up, and I went to perform a nerve block. And the reason I was performing the nerve block was that would desensitize the skin over the pastern and make it more comfortable when I actually injected the pastern. So I lifted her left front foot up to do the nerve block. I placed the needle, and as I placed the needle, she kicked me with her left hind leg while I was holding her left front leg up. So it was I wasn't hurt other than my pride, but it was a good reminder for me as well, as we always think that our own animal will not behave in a certain way. Luckily, it was just a good reminder. It was God's way of reminding me that I need to pay more attention. So don't assume. Always stand on the same side of the vet. And, why is that? You definitely want to be on the same side because it gives you control of not only the front end, it gives you control of that back end. So if the horse is acting up, if you pull the horse towards you, the back end's going to go away from the veterinarian, right? Pay attention to your horse's eyes, their ears, their lips, etc., to determine if they're distracted or agitated. If they're starting to move, talk to them, say, whoa, then your vet, whose back is usually turned to you, will know what's going on. If they seem agitated, let the vet know right away. And if you're going to give your horse a correction, also let your vet know that you're going to do that so that they don't happen to be under the horse if you happen to give them a jerk on the chain or something. But yes, you want to be able to move that back end. You want to always, too, give your horse an exit. So remember that they're flight animals, right? They're prey animals. They want to be able to get away from danger. And if you don't have a clear path of an exit for a horse, they may feel trapped and they may actually react more violently. And so if your horse decides to make an exit, you don't have to make him choose between running you over or running the vet over. Always remember that if a horse decides that they need to make an exit, they will one way or the other. And it's better if they just have a way out than they run over you or crush somebody into a wall. All right, so before the vet leaves, you want to make sure that everything's checked off your list. You've got your list. You want to make sure you understand any aftercare that may be needed following a procedure or wound care or something like that. Understand what to watch for. This is your opportunity to ask all the questions. Go over your medications or other instructions. Find out if there's a recheck appointment needed and when do we need to make that appointment. If there's not a follow-up to this appointment, ask what's next for preventative care. So we did our spring preventative care. We did our spring shots. When do I need to see you again? When does my horse need to see you again? When should it be scheduled? Make sure that you have all of your questions answered. And then what's the best way to reach your doctor? So ask how to best connect with them if you do have follow-up questions. Is it email? Is it a text? A lot of clinics have a dedicated text number now. I will tell you right now, it's certainly most likely not a Facebook message. But you want to find out what the best way is going to be to reach the doctor if you do have questions. So I told you a couple times that we talk about preparing for emergency. So who will you call? This is super important. I mentioned briefly that there's there's quite a large number of veterinary practices now that have messages like this on their website. So reserves are emergency services for current clients owner only. This means that we have seen your horse for non-emergent veterinary care within the past year. Now, this timeline may change, may be different between practices. The key is you need to know what your practice's emergency policy is, okay? You need to know if they will see non-clients in your area. And if they won't, you need to have a relationship with the veterinarian that you want to provide that emergency services. And that relationship is that VCPR, veterinary client patient relationship. And that VCPR, in order to be valid, is usually a 12-month, having seen the veterinarian within a 12-month period. So ask these questions, if you are new to an area, do they take non-client emergency calls? If not, make sure that you make an appointment and start a relationship with that veterinarian, especially if you've moved to a new area. And then ensure access to transport. This is huge. Most people have horse trailers, but not every single person has a horse trailer these days. You may find yourself in a situation where there is somebody unable, your veterinarian, for example, has 3 or 4 emergency calls ahead of you. You can't get anybody to come out to the farm, and you need to transport your horse somewhere to the closest clinic or something like that. So if you don't have a horse trailer yourself, have a contingency plan in place where you can, perhaps borrow one, find out if there's trailer rentals in the area, or find out if there's a service in the area that will transport horses for you in the case of emergency. Then have an emergency kit on hand. And this can be something you can work with your veterinarian to put together, but the basic things that you need in there: thermometer, wound dressing, bandage materials, scissors, things like that. You might want to have some Banamine or some Bute on hand, so that you have that available if you have an emergency. And perhaps you might not, maybe the vet can't get there for an hour or two, but if you have some things on hand, they may be able to walk you through something that you can do in the meantime while you're waiting for them to get there. And then know your horse's vital signs and be prepared to give them to the veterinarian over the phone. So if we're talking about vital signs, what do the letters TPR stand for? I bet most of people on the call know exactly what those stand for. But if you don't, I'm going to tell you right now. So TPR stands for temperature, pulse, and respiration. So I've got the normals right here, and I'm going to pause here for a second. If you guys want to take a screenshot, you're more than welcome to do that. Remember, these, though, are for the adult horse. So foals will be a little bit different than this. Foals tend to run a little higher on all of these numbers. So, but for sake of averages, I think most people on the call probably have adult horses. So, and then you want to not only know what these are, but you want to know how to take a temperature. If you don't know how to take your horse's temperature, that's fine. When your veterinarian comes out for the spring exam and spring shots, I assure you, they will be happy to show you how to take your horse's temperature. And you don't need a fancy thermometer. You can get a fancy large animal thermometer, but honestly, the little ones you get from Target or Walmart, little digital throwaway thermometers, are just fine. You just have to push them in a long ways. And don't worry, you will not lose it. It won't get stuck in there, because I have a lot of clients that worry about that. If it goes in too far, it will come out again and you won't have to go get it. It will come back out. Know how to take your horse's pulse. So again, if you don't know how to do this, there's a nice vein that runs under their jaw where you can feel that pulse. Again, your vet will be more than happy to show you how to do that. And I'm sure that I can ask, Julie can probably jump in at the end here, Dr. Shakota. I bet there's some videos on My Horse University or some things that walk you through that as well. And then respiration. So watching your horse's sides move in and out or watching their nose flare will tell you how fast they're breathing. Okay, so I talked a little bit about education, right? Knowledge is power. That's what we're doing here tonight. There are so many opportunities to learn. That's one of the great things about technology is there's things like My Horse University and other educational opportunities. Often they're available through your veterinarian. So your veterinarian is the number one place to go to for education. That's part of our job when we're doing an appointment with you, is to help to educate you and answer your questions. We're all perpetual learners, veterinarians included, so we're always learning every day. We know that you're learning every day, and we want to help you do that. So they're going to be your number one source. Oftentimes, veterinarians and veterinary clinics will often offer client seminars or webinars. Make sure that you try to attend those when you have time to do so. There's national, state, and local equine associations, right? They all offer some sort of veterinary type horse care offerings, webinars, again, things on social media, Facebook Live, and stuff like that. So those are great places to look. And then, of course, your university extension is another good place to look and learn from. The AAEP, or the American Association of Equine Practitioners, you can go to the AAP website, and they have lots of information for horse owners on horse vital signs and all of the most common diseases, the different types of things that we vaccinate for, why we vaccinate, vaccination schedules, things like that can all be accessed there. Things that you should use with caution for education. You all know what I'm going to say. So Dr. Google, right? Where do we go when we have a question? I do it all the time too, right? I go right on Google and I Google it. It's not that there isn't good information on the web. Absolutely there is. There's just so much information that is not good and not helpful. So you really have to be able to weed through that. And that can be difficult. It can be time consuming. Again, Facebook, Instagram, TikTok, there is so much misinformation out there. I see it every day because I'm on those sites too, and I cringe at some of the things I see. And then I start reading the comments on the things that I see, and I cringe some more because there's just a lot of misinformation out there. Your veterinarian's going to have great information if they have a social media presence. Again, that's a great place to look. And these other things on the top of this slide too will have good information on social media. There are good things on TikTok. There are clinics. I know, several years ago, I did a YouTube video on how to do, how to place a bandage properly. So there is good information out there. You just have to be able to weed through it and wade through all the misinformation. And sometimes that can get kind of tough. So that's why I say use those things with caution. All right. So last year, the AAP put out this really nice infographic on the left here that's shared with horse owners, highlighting the fact that we have this short supply of veterinarians and some of the things that horse owners can do to help with that and to ensure that they get the best care. Most of the things we've touched on already, but there's a couple more that I just wanted to go through. So observe business hours. And what does this mean? Because of course you're thinking to yourself right now, well, of course, I'm only going to make an appointment during business hours unless it's an emergency. And that absolutely should be the case. But, we have these things called cell phones, we have Facebook, we have other ways of contacting people. we're so used to being able to send a quick text off. Some veterinarians will share their cell phone number with you. And remember that when they do that, that's a privilege. And so use that, the knowledge of that cell phone number judiciously. Please refrain from, calling your veterinarian after hours with, non-emergent questions. Remember, it might not be their night on call, right? Especially if they're in a multi-doctor practice. So try not to reach out to them after hours. And then that goes for texting too. So remember, as a veterinarian, when we're on call, we have to look at, when our phone dings and that notification goes off, we always have to look at it. And so, you might be thinking to yourself, because it's dinner time at home and you just popped into your mind, I need to ask my vet, X, Y, and Z. But I don't need to call and it's not an emergency, so I'll just send a quick text off. And that seems very harmless. What I would ask is just think about the fact that we always have to be checking our phones no matter what. And every time the phone dings, we think it might be an emergency. So if you have a question that's not an emergency and you have the ability to text your vet, what I would ask is that you please hold on to that question until tomorrow morning. Or if you have the ability on your cell phone to schedule that text, schedule it for the next business day so it goes through during business hours. Remember, again, that every notification we have to look at. So remember that veterinarians have families, they have friends, they have events, and hopefully they have hobbies, and they need their downtime from work in order to be able to be there and be able to provide the care that your horse needs and you need. And so they're nice and refreshed when they get back to work the next day. Show gratitude. This is just even the little things, right? Like just little thank yous and telling them that you appreciate them for what you do. That goes such a long way. So it doesn't have to be a big deal. But so often, as you all know, so often in this day and age, we focus on the negative things, and we forget to say the little thank yous. So showing a little gratitude, showing a little appreciation, saying thank you will go a long ways in somebody's day. And then, if your vet's helped you out, share a great review for them. Great reviews go both ways. So we know that we have great clients, and we appreciate when we get great reviews back for the care that we provide. All right, so we're wrapping up here. Being well prepared for your veterinarian's visit is going to ensure that exam is going to go smoothly and that all of the necessary procedures, all the things that you want to get done are going to be completed efficiently and without being rushed, right? Because when we're in a hurry, we don't always do our best work. So we want to make sure that we have enough time to get everything done for you and your horse. So we also want to do it efficiently. We want to save time. We want to save you money. And that positive experience will further deepen your relationship with your veterinarian. Also, if we're not rushed, it's going to be a better experience for your horse as well. And having that great relationship with your veterinarian is going to allow you to work together to provide the best possible healthcare for you and your horse, and to help you reach your goals with your horse. And with that, I'd be happy to take any questions.
Thank you, Dr. Pribyl, for a great presentation. So now
Thanks,
you can
Julie.
ask Dr. Pribyl questions using the Q&A feature. If you are listening from Facebook Live, please type your questions in the comment section. And we have one right off the bat. What is your opinion on teaching clients to give routine injections such as vaccines?
So my opinion on vaccinations is to have them. I would prefer that they are done by a veterinarian, honestly. And the reason being, Well, there's multiple reasons, right? So usually when we're doing a vaccination appointment, it does give us an opportunity to have that one-on-one conversation and visit with you about your horse, right? It's sort of that annual exam visit. Um, and not only that, we always want to go through and do, a TPR on your horse, especially a temperature before we give vaccinations. And the reason for that is horses can look pretty darn good and still sometimes run a low grade fever. And if your horse happens to have a fever, we're not going to want to vaccinate them that day. So I've run into that multiple times. And if they're already fighting something, it might be not that obvious to the eye, but we're going to probably be able to detect it. And then we're going to avoid vaccinating them that day. And why would that be? That's because their immune system's already doing something, right? And so when we give them a vaccine, we want their immune system to do something, but it's already working. Now, if we happen to give them a vaccine and they're a little bit sick, we are run a little bit more risk of having that horse, react. And so those are sort of the reasons that I would prefer as a veterinarian to give vaccines to your horse. Certainly, teaching clients to give injections, I think veterinarians do that all the time. And I do think that's important for horse owners to learn how to give intramuscular injections, because at some point you may need to do that. If your horse has has some sort of infection or something and they need to be on antibiotics, injectable antibiotics. It's always good to know how to give injections properly, where to give them. And certainly your vet is going to be your best teacher of that, because if we give injections in the wrong area, it can be very, very harmful. And in fact, even deadly in some cases, if you're trying to give something intravenously and you end up giving something into the artery or something like that. So your veterinarian will most likely be more than willing to teach you the right technique on giving an injection. But as far as vaccines, I do like that veterinarians have that in their hands.
Thank you. As far as telehealth goes, and I'll tell you from my experience, I've not been doing telehealth, but from what you've spoken with other vets, what sort of telehealth discussions are they having with clients, and are they talking about vaccines at these telehealth appointments?
Yeah, so it kind of depends. Again, what can be done on telehealth is a little bit state driven. So I can't really speak to, all the different states, but the types of appointments be like, it might be a follow up visit to sort of discuss how a horse is doing or something like that. Um, Pictures, of wounds and discussing how we're going to care for that wound. There's a lot of things most things I think we can't do via telehealth, but I think there is the opportunity to use that as a tool, right? And it can save some time for people on either end. So is that helping to answer the question at all?
Yeah, absolutely.
Yeah, yeah,
Absolutely.
yeah. Sort of like that Cushing's discussion I was talking about. Like, my horse is doing okay. They have Cushing's, but I'm thinking about changing to this different feed, and that can be, a short discussion, but it could be a lengthy discussion. So having an actual appointment for that, just like you might visit with your own doctor about, making a change, can be helpful. And not everyone is implementing telehealth, but I'm starting to see it more and more in different practices.
Thank you. How can horse owners stay up to date on best practices in basic horse care and management so that we need your professional services less often?
So I think this is a great way, right? Maybe not what we did tonight, but I think you've had multiple webinars, right, this spring. And certainly we'll have more. I don't know when your next ones are scheduled. Julie, do you have more scheduled for the fall or?
next year, and I think this would be a great one. What is an emergency? So I think that would be
Yes,
a good one, just talking about specific like choke and things like that. We can do that
yes,
next year.
absolutely. Yep, yep.
Mhm.
So also, uh, I mean, love Michigan State, but there's other universities
Mhm.
too, right? And all the university extensions usually have something like that going on. I know AAP had something recently for horse owners, or it might be coming up. So usually your veterinarian will be aware of that, and they may send out some notifications, via social media or something like that, of things that are available to horse owners. There's a great magazine that's called The Horse, and that is affiliated with AAEP. So it has really good horse health information in it. So it's a good source of information, right? So you're always looking, again, sometimes it's hard to weed through the sources, right? To make sure you're getting good sources. But those are your best sources to be educated. And ask your vet too. Is there, do they have any seminars coming up? Because oftentimes veterinary clinics will host a client seminar, in the winter, when it's a little bit slower, in the fall, things like that, to keep their horse owners educated.
Yeah, absolutely. And actually, Dr. Scally posted in the chat one of the educational components of My Horse University that you can refer to. It defines and discusses different equine emergencies and what to put in a first aid kit. So go ahead and look at the chat and click on that link if you're interested.
Yeah, and I think you had something on there too, when I was looking today about vital
Mhm.
signs and how to take those and things
Mhm.
like that.
Yeah, absolutely.